management, or sponsors. Welcome to your Hometown Health Show, brought to you by Triology Home Healthcare, the industry leader with over 30 years of experience in providing home healthcare services such as skilled nursing, physical and occupational therapy, home health aides, and other specialized care to your homes throughout the state. Please tune in every other week as we bring you a range of good information from specialists in the field to help make you more informed and living healthy.
Hello and welcome to our Hometown Health Show sponsored by Triology Home Healthcare. We are pleased to have some very special guests this evening on our show. We have Michael from Senior Helpers and Peter and Ina from Allegro Senior Living. Welcome, gang.
Thanks for having us.
How are you doing? Thank you for having us here.
Good. Glad to have you guys. So, hi, gang. Michael, why don't you start by telling our listeners a little bit about yourself and your role at Senior Helpers?
Well, again, my name is Michael Mull. I'm the owner of Senior Helpers. We've been in business for over 10 years. We are a licensed and accredited home health care agency. And in Florida, that means a little bit different than what it means to most people, and we'll go into that a little bit further. But we are basically providing care from 1 hour up to 24/7 throughout Boca, Delray, Boynton Beach, and Lake Worth.
Excellent, excellent. Can you tell me a little bit about the types of services that you guys provide?
Absolutely. Home care is broken into two different types of care in Florida. And a lot of people don't understand when they hire a home health care agency or a company that you have companies that are completely independent contractors, which are called nurse registries in Florida. And then you have agencies, which are employee-based. And that's the private side. So we are a private side. So we take, it is credit card, check, long-term care insurance, VA benefits. And then there is also home health care, which is through Medicare, where a doctor will write you a prescription. The care that we provide is the private pay. And we, as I said, we are employing only W-2 employees. So they work specifically for me. They're covered with workers' comp, liability insurance. They're supervised by a nurse, director of care management. We have an entire HR department. So when you have an issue and you have a agency working for you, you have a company that's basically ensuring that everything's moving smoothly. What people don't understand is when they get or something happens to them and they come home from the hospital and somebody says hire a home health care company, they may go and say, well, so-and-so's the cheapest company and I'm going to hire them. They don't understand that nurse registries by law are independent contractors. They're not to be supervised. They're actually supposed to set their own rates. The company doesn't pay for their workers' comp. They don't pay for their liability insurance. You are basically dealing with a employee in your home that you're responsible for. So if you're paying them, working them over 40 hours, you may be responsible for paying their taxes, not the actual registry. With me, everything's covered through our company, and it's really important for people to get that understanding that you got to ask, am I getting an independent contractor or am I getting an employee of your company that you're responsible for? We go to the depths of beyond what the state requires in background checking, drug testing, DMV checking, as far as caregivers needing to drive their clients to and from doctor's appointments. So we verify everything to that extent where that's not required by the state of Florida. Many states, including the closest one to us, Georgia, has actually outlawed nurse registries due to the fact that they don't protect the client correctly.
Okay, so if I'm understanding you correctly, when you're looking at nurse agencies versus nurse agencies have a built-in layer of security for the client to where everyone's licensed and bonded, and if there's an issue, the client is protected in the home.
Right, the home health care agency, first a nurse registry, but the home health care agency is actually protecting you with layers of coverage. So if anything happens, you call the company will deal with the issue. Where the opposite occurs with the nurse registry, when you have an issue with the actual independent contractor, you need to deal with the independent contractor. If she hurts her back, she has no workers' comp. Most likely she's going to have an issue with the person who she's working for. If we have an issue, they go out on workers' comp and we put another caregiver into your place of living, whether it be your home or your senior community that you're living at.
Excellent. Well, that should really provide your clients with a nice peace of mind and know that they're protected and will receive vetted, excellent care in the home.
And supervised.
Wonderful, wonderful. Tell me a little bit about your specialty programs that Senior Helpers offers. Do you have specific things that you guys have expertise in?
Absolutely. Senior Helpers of South Palm Beach, which is the one that I own, and that's Boca Raton, Delray Beach, Lake Worth, and Boynton Beach. We specialize in Alzheimer's and dementia. Actually, I'm an Alzheimer's dementia trainer. My wife is an Alzheimer's dementia trainer, and our director is an Alzheimer's dementia trainer, as well as we're Parkinson's set, and we just passed the Jewish Family Services. We are also Holocaust set to train our caregivers to deal with first, second, third generation Holocaust survivors and get a better understanding, because certain things may occur that you wouldn't think of that may affect them, and we want to make sure that our caregivers are brought up to date and understand that there's a lot of emotional stuff that goes on with people that were survivors that may not bother you or I, but certainly does bother them from things that they went through.
Right, that's wonderful, and the sensitivity to those issues and the knowledge base to be able to take care of those clients is wonderful. Thank you, Michael.
Thank you.
Moving on, this is a great time to introduce again our folks from Allegro Senior Living. Ina and Peter, why don't you let us know a little bit about yourselves and Allegro Senior Living?
Well, my name is Peter Cowley. I'm the Executive Director of Allegro Senior Living. That's located at 11450 Hagen Ranch Road in Boynton Beach. We're just south of Boynton Beach Boulevard on Hagen Ranch Road. We have a large independent, assisted, and memory care community. We've got 136 apartments, 67 are independent. We've got 44 assisted living, and then we've got a 25 apartment memory care. And that's where we are. That's what we're doing.
Excellent. Ina, anything to add?
Well, Allegro's been open for this June will be 4 years, and I've been there from the very beginning. And it's our job to provide the best services possible for the clients that are coming to us, and that's what Peter and I look to do every day.
Well, we're excited to have you guys. From being in the healthcare community, you guys are a preeminent senior care community, so we're excited to have you on tonight. Allegro's tagline is inspired senior living. Tell me what that means to you.
Okay, so there's no single answer per se, but it really allows residents to live life however they want to, and on their own terms and with lots of possibilities. We've got a very active group of people that live with us, and as such, my lifestyles director plans a very active calendar. And there's something for everyone. And the whole idea of people that are moving into an independent living and assisted living, for that matter, is they want to stay healthy and well, keep themselves busy, and that's what we do. So if they don't find an activity on the calendar, we'll make sure, as long as it's within reason, we're going to have it on there for them. So it's going to allow people to be with others, enjoy what interests they have, possibly develop new interests, and so on and so forth. And that pretty much kind of describes inspired living, spending time doing the things they want to do.
Fantastic. That individualized activities and the socialization that's so important is wonderful, and you guys do an excellent job on that.
Yeah, and I'd like to just add, I think that a lot of people have a perception of senior living as not very exciting, and there are lots of bad media out there about what can happen in senior living, but I think with us in Allegro and many of our other people out in the community, it's just a very stimulating, inviting kind of environment. I mean, we allow a scenario or a situation for people to continue to enjoy their friends, their family, their hobbies. The meals are exceptional. We have tons of special events, as Ina mentioned. We take the residents out on outings. We have 2 big buses. We take them out every day to various things. We'll take them to the grocery store. We'll take them to the bank. We'll take them to the drugstore. We'll take them to the theater. We take them on boat cruises. You know, it's very fun and it's life well lived. It's not where people go to wait until they want to pass away. You know, it's just, we're very, very high end. When you drive up to our community, it looks like a resort hotel. The landscaping's thick. It's beautiful. There's a grand sense of entry. Very welcoming, very high level of concierge service. It's not, unless you've been in one of these places, you might have a preconceived notion if you've watched the bad stuff on the TV. You might have a preconceived notion this is not for you. But if you are young at heart and you want to meet new friends and you've got some you want to be social, then it's a really great way to spend the later years of your life, especially maybe if your spouse has passed away and you're feeling a bit lonely. We have 136 residents living with us that are vibrant and fun and challenging sometimes, but
Yes.
it's a great place to live your later years for sure.
That's wonderful. I know from visiting your community and being a guest multiple times, every time I leave, I want to move in. So that is a wonderful thing.
We have a room for you if you'd like.
We do.
I have one reserved.
Excellent. Maybe we can get a group rate. So you mentioned independent living, assisted living, and memory care. Can you guys lay out a little bit about the difference between the two and the services that are provided in each?
Sure. So independent living is just what it sounds like. It's living independently on your own. The difference when somebody moves into independent living at Allegro rather than staying in their home is that they're getting a whole bunch of services and living in a beautiful environment that they don't have to worry about fixing the roof or if the toilet overflows. We have a staff to do that. They also have activities planned for them. That's also part of independent living. And then, of course, there's meals, which is one of the biggest reasons that people want to come to independent living. They still want to have a lovely kitchen, which they can have at Allegro. However, we provide a continental breakfast, and we provide other meals as well. So delicious food in a social atmosphere, that's basically what makes Allegro independent living that way. When you talk about assisted living, we then add on some care services. So assisted living is not what many seniors think it is. It is just that. It is assistance with activities of daily living. So people that might need a little bit of help with medication management, they might forget. That's something we would do for them. People that need some help with showering, dressing, grooming, things like that, that's part of assisted living. So when somebody says, I don't want to ever go to assisted living, I usually will say, well, why? And they then describe a nursing home from the 1970s.
Right.
No, that's not us. We have some incredibly active, awesome people in our assisted living. They just need a little bit of extra help, but their minds are perfectly fine. Just because somebody uses a walker or a cane doesn't mean that they're failing in any way, shape, or form. We're just helping them to continue living independently. Our assisted living is basically a standard license, which means we're not a medical facility. As a matter of fact, we don't call ourselves a facility at all. We are a community. We provide services so that our residents can stay independent, but we encourage them to stay independent. In assisted living, they get 3 meals. We do their laundry. We come in and we make their bed each day. They still have a beautiful apartment, just like all of the folks in independent living. They just don't have a full kitchen. It looks like a full kitchen. It just doesn't have a stove. Why? We're giving them 3 meals per day. They don't have a washing machine and dryer. Why? We're doing that for them. So that's just some of the small differences. But as far as all of the activities and amenities and concierge service, they're for every single one of our residents, whether they're in independent or assisted living. Anything you'd like to add?
No, that was great.
Okay.
That's wonderful. I think we're coming up on a break in a few minutes, but we can go ahead and start. I'd like to know a little bit about memory care. You mentioned memory care and what the difference between assisted living and memory care would be.
Yeah, I think at memory care, unfortunately, memory impairment is a disease that grips a lot of elderly seniors. The statistics are scary about how many people actually contract memory impairment. And important for people to know that losing your memory isn't a normal part of aging. If you start to have time and place orientation, you forget. It's not just about where did I put the keys. We all forget where we put the keys. This is putting the keys in the cupboard or in the refrigerator, or somebody showing up at your door that you arranged a meeting with tomorrow and you didn't know they were coming, or you don't remember family members' names. So when it gets to that point, usually there's some signs, and usually the main caregiver is a family, usually an adult child or a spouse, and they become the main caregiver. And for those out there that have become or was a caregiver or are a caregiver, you will feel the signs of complete exhaustion. As 24 hours a day, you're looking after this person and maybe helping them with all of the things that Ina talked about: bathing, grooming, dressing, safety. They may be wanting to walk out the front door, and it's an exhausting thing. So that's why places like us are there. Of course, we have a large team that will look after residents 24 hours a day, and it's what we do. We're trained to do it. We know how to talk to people with memory impairment, and so that's what it's there for. You know, if you're feeling like your loved one is has memory impairment, dementia. Dementia is sort of the umbrella term. Alzheimer's, is one of the main dementias out there. Then you should come and see us. And when you move your resident in with us, it is an amazing experience. I've been in many memory cares in the U.S. and certainly around Florida, and we have just an exceptional one. The residents are, from timing getting up in the morning and having breakfast, they're dressed and ready for the day. And the activities go on from after breakfast through the entire day with a break for lunch and a break for dinner, but until they go to bed. And it's our plan to make sure that the residents stay engaged all day long. I jokingly say we don't let our residents hang out in the rooms and sleep, but we sort of don't let them hang out in the rooms and sleep. Okay. Because we want them up and engaged and socialized all day long. And then when they go to bed at night, they sort of follow a normal circadian sleep rhythm. They sleep. And because I think any of us, if we were to nap during the day, like a lot of our competitors let their residents do, they're going to be up at night. We would all be up at night if we slept during the day. So we keep them up and engaged and socialized and challenged with their brains. And we do music and we do art and we do singing and games. We just do tons and tons of activities. Not that they're going to remember it in 5 minutes from now, but it really is just making sure the residents go from time to time to time. We also have a large bus for our memory care, and we take all of our residents, all 25 that can go, out into the community twice a week.
That's
and
wonderful.
We'll take them to the beach in Delray. We'll go to BurgerFi and order burgers and take them to the beach. We take them to the library. We take them to the zoo. We took them to the Lion Safari recently. We're not afraid to take the residents out of our community. They're not in jail. Family members can take them out anytime they want. It's completely social, loving, kind environment. And we have some of the best caregivers and nurses dedicated to our community. I say to them every day, I think all of our caregivers and staff have earned their angel wings, because the work that they do with these residents is something to behold. So our memory care is very special, and I think if you're a caregiver and you're at your wit's end, you should come in and talk to Ina and get a tour and see what it's all about. So,
well, it sounds to me like through your programming and engagement, you really allow them to stay active, but you take the caregiver piece off the loved ones and allow them to be sons and daughters again.
That's exactly the point. You know, you can come as a spouse maybe who you're going to feel guilty. I mean, I think it's till death do us part. It's not till I move you into a memory care facility, you know, but you're not having to provide that care. Right. You can come, let us provide the care, and you can just look at your husband or your wife and tell them that you love them and you care for them and be their wife or their husband again or their daughter again. And so it's exactly what we do. Yeah.
That's really special and a
And
privilege.
just to add on to what Peter said, we love to have the family involvement. There's so much guilt in the first place with placing them, but they are welcomed for every activity. They can meet the bus wherever they go out on the field trip. They can come in and participate. And we've got spouses and sons and daughters there all the time. And that, I think, helps make it extra special. And then they also support each other, too. And we support that because nobody knows what they're going through like somebody else who has a loved one in our memory care neighborhood. So I think that's just an important thing to add.
Yeah.
I know, that's wonderful. Thank you. I know that one of the things that sets you apart, because I've watched you in action, is sitting with families when they're trying to make this heart-wrenching decision and helping them through the process and helping them identify whether assisted living or memory care is appropriate, or maybe Michael's company needs to get involved from a care standpoint. Tell me a little bit about that process and how you handle when families come for a tour and go through that with them.
Well, it's one of the things that I do with every family that I meet with is I sit down with them and I ask a ton of questions to the point where they probably are like, why are you asking so much? And the reason I ask so much is I'm trying to figure out what the situation is. Where is this prospect in the scheme of things? Where's the family at? How big is the denial issue? Because that's usually a big issue. And getting to know the family and the potential resident helps me at least know if we're going to be able to help them in our neighborhood. And certainly if not, that's where I might refer out to Michael and senior helpers. But my job is to see what can we do to make their loved one's life that much better, and to make the caregiver able to have a normal life again and enjoy their spouse or their parent as their spouse or parent, and let us do the hard work. Most people come in and say, you have no idea what I'm dealing with. You can't do anything. I'm telling you, you can't. I'm telling you, we can. Our staff is incredible. I'm just going to say what Peter did. We have got an amazing team of, between nurses and our CNAs and med techs and our lifestyles people, we've got an amazing team. And that is what they're trained to do. They are very special people who have definitely earned those wings. And that's really what it's all about.
That's really great. Just looking at your face, you can tell this is a privilege on what you do, and you're really invested in these folks, which is wonderful. I want to field a question to all three of you, and I'll start with you, Michael, but tell me who pays for private duty care or assisted living and how that works.
Well, private duty care can either be paid through one private duty, which would be yourself paying for it. We do work with, and I am a certified long-term care professional, so long-term care can pay for it depending on your policy. One thing I will tell you is every policy is different. Some are for home care, some are for assisted living, some are for only for skilled care, some are for all three. So you need to know your policy. If you don't, you should talk to somebody and get an idea of what your policy is. Many of these policies were bought 20 and 30 years ago, and the people that were, our clients that we're trying to help don't really remember what they got sold 30 years ago. So one thing I'm very, I don't charge. I come out, I meet with you. I will go over your long-term care policy, and I will tell you exactly what you should be getting out of your policy. VA benefits are another way of aid and assistance is one of the things that they do, and that pays for a certain amount of hours. It's an asset-based payback, but it's a very good way if you're a veteran, and it's probably one of the best hidden secrets of the government is that it's a fully funded program to help veterans that don't have the assets to have the home care that they need to get that home care. And as I said, it's fully funded. It goes up every year, and it will pay for our service to come into your home and help you out. And then one of the other ways is there is a Medicaid Advantage plan. Sunshine Health is one of them. We work with them, and they will actually pay for our services to come out, and it could be from 2 hours up to, we've had clients at 60 and 70 hours a week who Sunshine or who are Medicaid Advantage has paid for home health care. And the long-term care will also pay for assisted living or memory care. It usually will not pay for independent care because that's kind of like Ina and Peter said, you're living in an apartment, but you're living in a community.
Right.
But you're in your own apartment. If you want to go out to dinner, you go out to dinner. But many policies will pay for us to be there at Allegro and help them with a few of their daily activities so that they can maintain their independence. And that's the whole goal of it. Let them maintain their independence, never take it away, but be there to support them when they do need us.
Okay. Let me ask a follow-up on the veterans aid and attendance that you mentioned. If my grandfather was a veteran, but he passed away, but my grandmother is still living, will it cover the surviving spouse?
Yes, aid and attendance, and there was a law change this year, but I'll go over that at the end. Aid and attendance will cover the actual veteran, of course. It will cover the veteran and the spouse, and it will give you a higher amount for a veteran and a spouse. It will cover just the spouse. If she needs or he needs help and the veteran does not, or should the veteran have passed, it will cover the spouse as long as the spouse did not get divorced and remarried.
Okay.
So that's the big key in there. The big change is that it used to not be a look back in age and attendance,
Right.
the VA benefits. This year there was some law changes and there is some look back, so you really need to talk to somebody and use a company. You're not able to charge for aid and to tell if somebody qualified for aid and attendance. There's a lot of companies out there that will charge you to determine if you qualify, but you're not supposed to by law.
Wonderful. Thank you so much. That's very informative. So, tell me a little bit about how you partner with Triology Home Health, which is my company and our show's sponsor. How do you work together with home health agencies and private duty? How does everything fit together?
Well, for me, I'm looking to offer as many services as possible. So if, for example, somebody gave me a call last month and they were looking for some information about moving to Allegro. They'd been told they couldn't go somewhere else. And as I'm asking questions of this woman, I realize this woman needs Triology services because I'm not going to be able to help her. So I was able to call Triology, bring them in, and get her the services that she needed. She was able to see a doctor right away, get some wound care for a wound she had, and get that moving along. When it comes to private duty, what I'll do with people as well is let them know we have a home health agency in-house. We've vetted them. They've been with us for the entire time we've been here, and they can provide some services in 15-minute increments. And, that way they can feel better about their spouse or their parent living in independent living, knowing that, if they only need a little bit of services, they can do that. So I love to work with both Triology and Senior Helpers because it just makes me a better resource for my clientele.
Thank you so much. And thank you all for being here. I think that's all the time we have tonight, but I want to thank you very much.
Thank
Thank
you.
you.
Thank you.
Triology Home Healthcare invites you to call our offices before making a decision about your home health and rehabilitative care. Different from other agencies, Triology offers specialized service that other agencies don't, providing exceptional care. That's who we are and what we do. Call us at 866-599-4959 or go to trilogyhomehealthcare.com. The opinions expressed on the preceding spot